So what we are seeing now is the demand for testing has dramatically increased, and we are no longer in a situation where we can continue to say anybody who wants a test can get a test. People who are going onto our website and looking at our community testing locations are seeing we're now about a week out before you can get an appointment. And obviously, if you're sick and you need a diagnosis today, a week later is not particularly helpful. So what we'd like to do is what we are doing today is asking that we change the parameters for getting testing. So first and foremost, anyone with symptoms should absolutely feel free to go to either their private physician as a first stop. Urgent care, still many of them are testing, and we're going to be updating that information about who continues to test. We have available as well testing in the community sites. But other high-risk categories that individuals should continue to seek out a test is if you work in a high-risk environment, particularly industries that have an awful lot of people of the public that you are interacting with. So high-risk environments, essential workers, are utility workers, grocery workers, food supply workers, public employees, first responders, healthcare workers, etc. Anyone who works in a congregate care setting should also, that's a high priority group who we want to see testing on. And when we do, as we've said many times, see any case in persons who live or work in that setting testing positive, we will do rapid fire testing of the entire facility as one of the means of controlling the outbreak in these settings. So that means correctional facilities, homeless shelters, residential care facilities, or dorms, should that come to pass. Individuals who have had close contact with a confirmed case, and what I would say about that is really it should be at the direction of the public health department. There are lots of people who maybe hear from Aunt Sally or Uncle Rick that, oh yeah, so-and-so was tested positive, and they think, oh no, I've been exposed, I better go get a test. What we are doing is we reach out to all the identified close contacts, and in appropriate cases ask that those individuals get tested. So what a close contact is 15 minutes in close proximity without either party wearing a mask. That's our definition for close contact. So there may be other individuals who believe that they have had an exposure, but again, asymptomatic people, we are asking you to save what is becoming a decreasing resource for the people in these highest risk categories and those with symptoms, and to defer testing if you don't fall into one of these categories. I would also ask that people who have made appointments and are not able to use their appointments or choose not to you can actually go in and cancel the appointment. We have started to see an awful lot of no-shows, and that is just using up an important resource for people that are waiting more days to get a test. So please do cancel an appointment if you have one.